Hi everyone, my name is Dr. Stephanie Weyrauch. I'm a physical therapist at Physical Therapy and Sports Medicine Centers in Orange, Connecticut, and today I'm going to give a talk to you about chronic disease. First off, let me tell you a little bit about Physical Therapy and Sports Medicine Centers. Our philosophy is we are PT for life, which means that we are birth to death practitioners. Our physical therapists in our company treat all ages and all conditions. Of course, each physical therapist is going to have a different specialty, but we definitely have somebody that can treat you in one of our 31 locations. Our company's philosophy is to improve the quality of people's lives by providing unmatched experiences, clinical excellence, and lifelong relationships. We truly do form relationships with our patients, and we try to make sure that the customer service that you experience is of the highest quality, and the outcomes that you experience are of the highest quality as well. We have 31 locations across the state of Connecticut to try to make it convenient for you to receive care. I'm located in Orange. And like I said, my name is Stephanie Weyrauch. This is our location of the Orange Clinic, so it's pretty close by to where you guys are listening to this talk today. The name of my talk is Movement is Medicine. Manage your chronic disease with movement. So many chronic diseases in America today are treated with medication, but did you know that you can also treat and help improve your chronic disease with something as simple as moving? There's lots of different chronic diseases that we can talk about, but today we're going to talk about diabetes, osteoarthritis, and osteoporosis. These are the three diseases that we'll be primarily focusing on in this talk. As we continue to get older, the body starts to break down a little bit, and this is a natural part of aging. It's something that we can definitely slow down with exercise. So some of the things that can happen to our bodies as we age include decreased bone density, which is what can lead to osteoporosis. This is especially prominent in women when they reach menopause, but it is also prominent in men as they continue to age as well. We lose strength and muscle size as we age. Flexibility, our bodies become more stiff because we don't have the collagen that is necessary to repair tissues. We start to lose our balance a little bit more. Our heart can't pump as efficiently. Sometimes our arteries can get clogged with plaques, and that can cause blood to move through the body a little bit more irregular. We have decreased ability to create force, power, and, as we age and these things start to break down, we sometimes don't even really feel like we want to move, or it hurts to move. Other things that can happen is our bodies can become less sensitive to insulin, and that's what can lead to a disease like diabetes. And then our skin can become a little bit more fragile and tear a little easier. So let's talk a little bit about bone mass. So as we age, we have our bodies start to decrease in our ability to restore minerals to our bones. Minerals such as calcium, vitamin D, magnesium, these are all necessary to build strong bones. And when we're young, specifically in our teens up to 30 years old, we're starting to build bone and make our bones strong and get it ready for the aging process. As we start to age, our bodies can't restore and recycle those minerals quite as well. And that's the decreased mineral content is what reduces the density of our bones. When our bones become less dense, that's when we become at high risk for fractures and we develop osteoporosis. It's prevalent in males, but even more in females. And one of the reasons for this is menopause. Estrogen is actually very protective of osteoporosis, and it's very protective in having strong bones. Once women reach menopause, what happens is the estrogen that they produce decreases significantly, and that can actually cause bone to be lost. So this is a picture of this is a picture of normal bone, osteopenia, and osteoporosis. On the left, you'll see what normal bone looks like. And this is called spongy bone. So where we're more prone to fractures are kind of in the weight-bearing parts of our bones. So like our femoral head, which is highlighted in this picture, that's all made of this porous bone. As we age and we start to lose bone density, those pores become bigger and bigger. And if they become to a certain size, that's when we develop osteoporosis. And that means that our bone becomes more brittle. It doesn't have the strength to maintain that weight-bearing status. And this is measured on, we can measure this on a intervention or a machine called a bone scan, a DEXA scan. And so a lot of times when we reach a certain age, especially for women, our physicians will recommend that we get a bone scan, especially if we have risk factors for osteoporosis. And some of those risk factors include being Caucasian, being small and skinny, and having a history of osteoporosis in your family. And so how it's diagnosed is through this bone scan. What it measures is it measures something called a T-score. If the it's basically an average of a population. And if the T-score is at the normal range, then you have normal bone. Once it gets below a certain range, and we call these standard deviations, that's when we become more at risk for a fracture. And that's when we can develop osteopenia. Osteopenia is not osteoporosis, so the bone's not quite brittle, but you're on a course of potentially developing osteoporosis. And so we as physical therapists, we like to intervene more in the osteopenia range, but we can also benefit people when they reach osteoporosis. Another thing that can happen as we age is we lose muscle mass. And muscle mass in research has been shown to be a strong predictor of multiple things that can help us predict longevity. If you have a decreased muscle mass to a certain extent, it can be a cause of severe mobility limitation, slowed gait speed. It can be a risk factor for falling, having a fall so bad that you have to be hospitalized, and even for mortality. So our goal is to prevent this from happening at a pace that outpaces natural aging. So we're going to lose some muscle mass as we continue to age. So we lose about 1% per year. But we can still make up for that loss with other interventions that physical therapists provide. Our goal is to prevent something called sarcopenia from developing, and that's a large loss of muscle mass that can decrease somebody's change of function and their strength. So a good example of this would be if it's really difficult for you to get out of a chair without your hands, that can be an example of sarcopenia developing. So why does this matter? This all sounds a little depressing, right? We age, all of these things start to worsen. Is there any hope for us? Yes, that's one of the great things about some of these chronic diseases is that a lot of the problems that develop when you do get this chronic disease, or even this chronic disease itself, are preventable. And we can help you build the confidence so that we're preventing these problems from becoming exacerbated and from taking their natural course. I think this slide shows a really good example of the hope that you can have if you start your lifestyle change now. It's never too late. So there's 3 pictures of MRIs on this slide. They're each an MRI of the thigh. Letter C on the left side of the slide shows a 24-year-old thigh muscle, or thigh. And the dark stuff is muscle, and then the white stuff is fat, except for the bone in the middle there. And you can see that this person has a lot of muscle, a lot of the dark stuff, and not so much of the light stuff. Now, if we look at picture D, you can see that this person has a lot more white stuff and a lot less dark stuff compared to letter C. Well, the person in the picture of letter D is a 66-year-old male, and his fat mass is 57 kilograms versus 10 kilograms of letter C. His average steps that he takes per day is a little over 3,000, and he does exercise that's more than leisurely walking for 22 minutes per day. Now, if you look at letter E, the picture in letter E, which is on the far right of your screen, you have another picture of a thigh MRI, and you can see that this person has a lot more dark stuff or muscle compared to letter D, and a lot less white stuff or fat compared to letter D, but not quite as much as letter C as far as muscle and fat goes, but still pretty close. Well, the picture in letter E is a 66-year-old male as well. Same age as our middle picture. He has a fat mass of 34 kilograms, which is significantly less than letter D. And his average steps that he takes is over 12,000. So he's spending about 2 hours a day moving at a pace that's quicker than leisurely walking. So you can see how different the 66-year-old male looks and is in letter D compared to letter E. Both are the same age, but notice that their muscle mass is significantly different. Let's talk a little bit about diabetes. So diabetes is a disease that I'm very passionate about, and I treat a lot of patients who are pre-diabetic or who have diabetes who are coming to see me for exercise prescription. They want to decrease the complications that they have from this disease, and they want to get their blood sugar more under control for their doctor's visits. So what happens if diabetes is poorly managed? Well, first of all, diabetes is a systemic disease. It doesn't just affect the pancreas, which is the creator of insulin. It affects the entire body. If diabetes is poorly managed, it can lead to coronary artery disease, stroke, and it can even lead to peripheral arterial disease or wounds that don't heal on, most commonly, the feet. And that can lead to amputations because of the poor blood flow to help those areas heal. It can lead to eye disease or blindness, kidney disease or end-stage kidney failure. And probably the biggest complaint my patients have coming to me is neuropathy or nerve disease. And a lot of it is pain in their feet and their legs when they are active. What neuropathy can do is it can increase a person's risk for falling, it can cause increased pain, and it can also cause ulcers within the skin, which then potentially can lead to amputations. The other thing that people with diabetes are more at risk for is osteoarthritis. To avoid these complications, we encourage patients to have good blood glucose control, to check their blood glucose regularly, to have good blood pressure control so that their cardiovascular system stays healthy, and to make sure that their lipid management is under control. And these are all things that physicians help us as physical therapists track so that we can modify our exercise program and help improve these problems. Like a lot of the things that we've been talking about today, the risk of diabetes increases with age. Adults over 65 years and older, 25% of them here in the United States have diabetes. Approximately 2/3 of people worldwide have either prediabetes or diabetes. So it's a very prevalent condition that we can actually help manage and maybe even prevent from being diagnosed. So how is diabetes diagnosed? Well, diabetes is diagnosed by a 2-hour glucose tolerance test and fasting glucose levels. So when you go to your physician's office to have your to be checked if you have diabetes, on 2 separate occasions, they're going to measure your fasting glucose. If those results come out positive, then they're going to do a 2-hour oral glucose tolerance test to see how much your blood sugar goes up when you ingest something that has a lot of sugar in it. So normally we would see with somebody without diabetes, fasting glucose will be under 100, the 2-hour glucose tolerance test will be under 140, and their A1C will be 5.7. A1C is a measure that a lot of physicians like to get on their patients, and patients care about what their A1C is because their physician always kind of emphasizes it. And the reason that's kind of a gold standard is because the A1C measures blood glucose control over a 3-month period, whereas the fasting glucose or the 2-hour glucose tolerance test is basically one measurement at one time, and the A1C is more long-term. So that's why the physician really cares about that. Somebody with diabetes will have a fasting glucose of over 126, a 2-hour glucose tolerance test of over 200, and an A1C of 6.5 or greater. Now that number, 6.5, is not an arbitrary number. Prediabetes is considered when you have an A1C between 5.7 and 6.4. When we've done long-term population-based studies on these patients, what we have found is that we can help convert prediabetes back to normal much easier than diabetes. And that 6.4 number seems to be the sweet spot. Once you get over to that 6.5, it's a lot more difficult to come back from having diabetes. Prediabetes is an important condition to treat and to know about because a lot of people in the United States have it. Blood sugars are abnormal, but they're not quite high enough to be diagnosed with diabetes. But more importantly, the main intervention for people with prediabetes is lifestyle change. Changes in how we eat and how active we are can prevent over half of prediabetes cases from converting to type 2 diabetes. And that means that people won't develop the complications that come with this systemic disease. What is recommended is that people with prediabetes engage in 150 minutes of exercise per week, and this includes something as simple as brisk walking, and achieve a weight loss of 5 to 7%. If people with prediabetes can achieve these things, their likelihood of developing diabetes decreases significantly. So the moral of the story is movement helps prevent prediabetes from developing into diabetes. There are many medical societies that have certain recommendations for physical activity. The Centers for Disease Control, the American Diabetes Association, and the American Heart Association all recommend that people, normal people, pretty much everyone, engage in at least 150 minutes of moderate intensity exercise each week and 2 days a week of strength training. Now, if you've never really been an exerciser, you're getting older, you're noticing these changes, it's not too late. It is never too late to start exercising. One of the great things about something like exercise is that it does take some time to build that up, but you will always have some type of benefit from doing exercise, and the side effects are very, very little, unlike a lot of the medications that we prescribe to people with chronic disease. You don't have to start, so 150 minutes a week is about 20 to 30 minutes of exercise a day. So it's not that much, but if you're not really used to moving a lot, that can seem like a lot. And so I always try to encourage my patients to just start with 5 minutes of exercise per day. Just go out for a 5-minute walk, maybe go from a sitting position to a standing position a couple times throughout your day. If you do that 4 times a day, 5-minute walk 4 times a day, that adds up to 20 minutes. And that time adds up over time. So 5 minutes a day, 7 days a week, that's 35 minutes of exercise that you've already gotten. You're already getting closer to that goal of 150 minutes per week. And that's one of the things that we strive with our patients is we don't expect our patients who aren't regular exercisers, or maybe it hurts to exercise, to do that much exercise the first even month of physical therapy. We gradually build up your ability to be able to move that much with less pain. So what is the role of a physical therapist in preventing chronic disease? Well, physical therapists are experts in treating the movement system. And the movement system, I have a graphic here on the screen, is made up of multiple different systems. So you have the musculoskeletal system and the nervous system, the pulmonary, cardiovascular, and endocrine system, and then the integumentary system, which is our skin. And physical therapists treat all of these systems to help the movement system work better. Diabetes impacts most of the body systems that improve movement. It's commonly known that it impacts the endocrine system, but as we've seen in this talk, it also impacts the musculoskeletal system, the nervous system, the cardiovascular system, and the integumentary system. Pain from osteoarthritis limits people's ability to stay active. It can prevent somebody from engaging in exercise because it hurts. Also, people with diabetes are more prone to developing osteoarthritis. Osteoporosis can lead to fractures, which contribute to continued limited mobility. So if somebody has poor balance and they're afraid that they're going to fall, they're less likely to move. And physical therapists can help treat these conditions. So how physical therapists help you navigate a chronic disease is we provide guidance on physical activity participation. Even moderate levels of activity, including brisk walking, have been shown to improve the risk of diabetic complications and decrease blood pressure by 10 millimeters of mercury. And so our goal is to try to help you become more active, to help give you guidance on how you can safely increase your activity level in a way that's going to prevent any complications from occurring. We also know that exercise is one of the most potent interventions for people with diabetes to help improve blood sugar control as well as prevent progression of the disease. Physical therapists can also help manage pain from osteoarthritis without surgery. One of the reasons why osteoarthritis is such a debilitating disease is because as the disease progresses, a person decreases how much they move. And the more that you decrease the movement within the joint and the more that the joint loses its flexibility, the more biomechanical stress hits the joint, and so causing further degeneration of the joint. And so our goal is to help you improve your range of motion and maintain that range of motion to prevent progression or to slow the progression of the disease. Once we improve the range of motion, we can also improve how stable the joint is, as well as proprioception, which is how your joints communicate with your brain where they are in space. Joint stability and proprioception help with balance. So a lot of times people who have osteoarthritis, especially in the lower extremities, will experience poor balance. And that's one of the reasons why. Finally, we can help improve strength in people with osteoarthritis to help improve tolerance for weight-bearing activities so you can remain active and you can hit those recommendations by medical societies for physical activity. Physical therapists can also help improve bone density in people with osteoporosis by safely prescribing weight-bearing exercise. Weight-bearing exercise is another very potent way to try to treat osteoporosis. When you perform weight-bearing exercise, it helps to build bone and promote bone growth. We do that in a way that's safe for our patients. We also supplement that with balance training because we don't want a person to fall. We want to reduce a person's risk for falling. If a person does end up having an incident where they do lose their balance, we want to try to help you maintain and catch your balance so that you don't fall all the way to the ground and you don't have a major injury. So unlike the CDC, ADA, and AHA, who give general recommendations, physical therapists customize a program to a person's specific goals, the activities that they enjoy, their medical comorbidities, and their risk for certain complications. So we would never just recommend a person exercise for 150 minutes a week. We would help build up your tolerance, make sure that you're doing activities that you enjoy, and help you navigate this lifestyle change that you'll have to undertake in order to prevent some of these complications from developing. So what does the research say? One of my favorite studies that I like to quote when I talk to my patients is this one here. Exercise is very effective in treating diabetes. it helps to lower A1C. And this was a study that was done that helped show this. So it was a systematic review and meta-analysis of 47 randomized controlled trials that involved over 2,000 patients. So a systematic review is basically looking at all of the literature that's ever been published on this topic, and a meta-analysis is looking at the results of all those studies, combining all those results, and coming up with recommendations. The primary outcome that they looked at through this was A1C levels. And what they found is that when somebody was given a structured aerobic resistance or combined exercise training course, so this would be like going to a physical therapist, for example, their hemoglobin, their A1C declined by 0.67%. Now that doesn't really sound like a whole lot, but if you think about how A1C is measured, remember it's measured like 6.5, 8.0, right? So a 0.6% decline would, for example, be going from a 7.6 A1C to under a 7. So that's pretty profound. A lot of times, by just adding some of these exercise programs, it can help your A1C be much more controlled, your blood glucose much more controlled. They also found that when exercise was over 150 minutes per week, it had a greater benefit than people who exercise under 150 minutes per week. So you can see the difference was 0.89% versus 0.36%. So those who exercised over 150 minutes per week had a decline of almost an entire percentage point of their A1C. So for example, going from a 7 to just above a 6. Versus if they did less than 150 minutes per week, they went from, say, a 7 to a 6.7. But that still shows that even exercising less than 150 minutes per week had some type of benefit. They also found that there was a more pronounced decrease in A1C with exercise training compared to just giving physical activity advice. And that's a lot of times what happens when you go to the doctor and they say, okay, well, you need to lose weight and become more physically active. That's something that drives me nuts when patients say, yeah, my doctor says I need to lose weight, but I don't even know where to start. Like my knees hurt, I'm breathless. And that's where we come in to help provide that structure for you. They did show that if physical activity advice was combined with dietary recommendations, there was a decrease. So as long as if your physician is giving you specific dietary recommendations, you can still have a decline in A1C. So what are some examples of moderate and vigorous intensity exercise? So moderate intensity would be walking fast or briskly, water aerobics, riding a bike, playing doubles tennis, something like pushing a lawnmower. Those are all examples of moderate intensity exercise. Vigorous intensity would be like jogging or running, swimming laps, riding a bike fast or on hills, playing singles tennis, or playing a sport like basketball. Strength training typically consists of exercises lifting weights, working with resistance bands, sometimes using your body weight. That's a really great way to have resistance, heavy gardening, or even some forms of yoga. This is a stretching program that was actually performed in a randomized controlled trial for patients with diabetes. And that's one of the things that is always very important as we age, is to maintain flexibility, especially with people who have osteoarthritis. Like I said, one of the main problems with osteoarthritis and why it progressively worsens is because we lose range of motion because we don't really want to move into that painful range. And so by doing some gentle stretching and gradually improving how the joint is moving, we can decrease the speed at which osteoarthritis progresses. Some other examples of exercise that a person can do and utilize to try to prevent their chronic disease from progressing is Tai Chi. And I've talked to a few of you at the JCC and have heard that this is something that they offer. This is a ancient Chinese way of exercising that involves breathing, slow movements, and a lot of balance work. Research has shown that possible benefits of Tai Chi include decreased stress, anxiety, and depression, improved aerobic capacity, improved flexibility and balance, muscle strength and bone density, enhanced immune system, improvement in blood pressure, and a reduced risk of falls, thereby overall improving quality of life. And these are some examples of some research that have been done. Yoga is another great form of exercise that can help with flexibility, it can help with balance, and it can help with stress levels as well. One of the great things about yoga is that it also can help improve some back and neck pain. It's been very effective in treating those disorders. And like a lot of these other exercise interventions, it can improve the quality of life in people with chronic disease. And here's some research that backs that up. Exercising in water or aquatics is a great way to offload the joints. So this is something that a lot of my patients with osteoarthritis, especially in the lower extremities, they really enjoy this kind of exercise because the buoyancy of the water helps to make them a little lighter and helps to offload the joints. You can use the water for resistance. You can use paddles. You can use styrofoam weights. But even just walking through the water adds a little resistance to your activity. Possible benefits of aquatic therapy or aquatic exercise is improved cardiovascular health, improved strength, decreased stress, improved blood pressure, decreased pain, and improved mood. And this is some research about water aerobics. So I hope that you got from this talk that movement is medicine. Of course, pharmacological management of these conditions is really important, but there's a lot of side effects that come with taking medications. And as we age, a lot of times polypharmacy or a lot of medications can become a risk. By adding movement into your regimen, this can help decrease the amount of medications that you're taking because it's going to decrease the complications that develop from your chronic disease. I always say that if physicians would write on a prescription pad movement and hand it to a patient, our world would be a better place because then people will be maybe a little more motivated or a little bit more ready to come see a physical therapist to help them move. So what can you expect if you do come see a physical therapist? Well, we offer comprehensive individual examinations and assessment that really identify the problems that you're having in your ability to move. And then we work together to create a personalized treatment plan. We want to make sure that the treatments we're providing you with, whether it be manual therapy or some type of exercise-based intervention, that it's something that you will enjoy doing and that we can, and we want to try to help remove some of these barriers that exist from being physically active and being movement and from limiting movement, whether it be pain, weakness, lack of motivation. These are all things that we can help a person provide advice to try to remove some of these barriers. We also save time and money in healthcare because here in Connecticut, we actually have direct access. So most private insurance plans allow you to come see a physical therapist without having a doctor's referral. And so we can start getting that process going. As physical therapists, we work very closely with our physician colleagues to make sure that we're keeping them up to date on your progress with physical activity and that we're making sure that we're on the same page as far as the management of the disease. We treat a lot more than just chronic disease. These are some things that our clinicians treat. Some of our clinicians are specialists, some of us are more generalists, but at any of our locations, if you have a condition, a lot of times we have a physical therapist that is experienced in treating it. If you have any questions for me, you can reach out to me at my email. It's listed here on this slide. I'd be happy to answer any of your questions via email. I want to thank you for taking time out of your day to listen to this talk. You're taking the first step in managing your chronic disease and managing your health by just learning about how movement can benefit you. You can visit our website, call one of our clinics today, and we can help you on this journey. You're not in this alone. We want you to be independent with your movement. We want you to be able to do the things that you want to do. We don't want pain and decreased mobility limit your ability to enjoy your life. So thanks again, and I'm Stephanie Weyrauch. Have a great day.